I, as a cardiologist, am very much interested in cardiac syncope, and that's the main area that I actually see my long-term career in, and that overlaps with autonomic dysfunction such as POTS. The cause of dizziness is multifactorial, and really a lot of it can be teased out by a good and thorough history. But in a nutshell, the causes of dizziness can be cardiac, so it can be a rhythm issue, it's like a slow or fast heartbeat. It can be autonomic, which is to do with blood pressure control, and that's what we call vasovagal or POTS. But importantly, other causes can also cause dizziness, and that could be vestibular. So some patients say they're dizzy, and their dizziness, they actually mean they're losing their balance. And patients often get referred to me, and that's not really been teased out. So sometimes it's quite good that I can make the diagnosis of a vestibular problem, which is often middle ear, and give some good and simple advice. From the dizziness perspective and from the vestibular side, you can also, or strokes can also cause dizziness because they can also affect your balance. But those are the main subgroups. So in summary, you have primary cardiogenic, which is rhythm issues. You have autonomic dysfunction, which is vasovagal POTS. Then you get other issues such as vestibular and stroke, which can complicate matters. A simple thing I would do is someone, and it's very useful if they come and see me, is just to, if they can get hold of a blood pressure machine, put it on their arm and get their blood pressure at that point in time. And all the modern blood pressures actually do heart rate. If the blood pressure was normal and the heart rate was normal, then it's unlikely to be a cardiac reason for the dizziness. If they put the blood pressure cuff on, their blood pressure sitting at 80 systolic, then it's most likely to be a possible vagal. Or if they put the blood pressure cuff on, their heart rate is down at 40, potentially they've got a bradycardia, and that's the reason for their dizziness. The problem with dizziness is often it's very transient, so the time they can get the machine on, the symptoms could have passed. That's the problem. But those are simple things they can do. I would also say if dizziness comes on acutely unwell, always call for help. Get hold of your family, get someone nearby you, because you're never quite sure which direction the dizziness is going to go to. So always protect yourself and let other people know that you're not well is a good bit of general advice I would give to patients. If things deteriorate or worse, then obviously they could call an ambulance, etc. But putting things in perspective, of mild dizziness is a common symptom. If I stand up quickly from this chair, I might be dizzy just for a couple of seconds. There's no reason to go and see a doctor tomorrow. But if I stand up dizziness and I feel like I'm going to faint on a regular basis, that's a different issue. And that's what we call orthostatic intolerance. That would benefit from a medical review. In the end of the day, I think common sense goes a long way. If you feel vulnerable and at risk, then that's not a good thing. And humans are very well in tune when things aren't quite right. And I always try and tell patients, just listen to their inner little being that's telling what's right and what's not right, and just listen to it. That's would be my advice. Yeah, with that dizziness, particularly in an elderly subgroup, I'm a pacemaker. When I initially trained, my main focus was in pacemakers and device, which obviously is still a big part of my practice. And a slow heartbeat, like complete heart breakdown to 30, is a serious cause of dizziness, because that can result in patients blacking out completely with head injuries, hip fractures, etc. And indeed, a lot of my pacing practice, the poor patients have had falls before coming to my attention, and it's been missed that there's been bradyarrhythmia. They've had the hip replaced, but no one's actually cottoned on that maybe there's been a rhythm issue causing it. And some patients have had 3 or 4 major traumatic events before they come away, and then I put a pacemaker in, for example, and they've never had another issue since. So you need to be open-minded to that. So there definitely can be serious causes of dizziness. Well, depends on the cause of dizziness, for example. So simplistically, if you've got a slow heartbeat that's profoundly slow, and it's consistent with what we call a serious bradyarrhythmia, a pacemaker will cure you. And of all the procedures I've done, a pacemaker, to be honest, is one of the most gratifying operations. A simple operation in good hands, and it transforms the patient's life. Sometimes people might have cardiomyopathies, they may have fast heartbeats and implant defibrillators, and that would stop sudden death in that individual. So that makes a big difference. That's easily done. But by far the biggest cause of dizziness would be orthostatic intolerance, i.e. low blood pressure, lightheadedness, etc. And sometimes just adjusting the patient's medications, increasing the fluid and the salt, are simple remedies that can transform it. So my answer to dizziness, really, it's a broad spectrum of illnesses, and there's some simple solutions, some more complex solutions, but generally you can get people a lot better than what they are, and you can save lives.